The Nuss procedure, developed at Children's Hospital of the King's Daughters, is a minimally invasive surgery to correct Pectus excavatum, also known as sunken chest. The surgeon first makes 2 small incisions, one on each side of the chest. Then inserts a curved metal bar through the chest cavity, under the sternum or breastbone. When the pectus bar is flipped 180 degrees, it immediately pushes the chest wall out into a normal position. The bar is stabilized to the ribs and remains in place for 2 or 3 years, so the chest wall can gradually harden into the proper position. Bar removal is a simple outpatient surgery.